Welcome back to McLaren-Port Huron's Today's Health Program. I'm speaking today with medical oncologist Dr. Alsawah about lymphoma. Dr. Alsawah, what are the symptoms of lymphoma?
Most lymphomas really have very nonspecific symptoms. The most common symptom is a patient feeling a lump under the arms or over the collarbones, in the groins. Most commonly, notoriously, classically, like somebody was shaving and felt, oh, what is that? So feeling a lump is the most common symptoms, but other common symptoms are nonspecific, like tiredness, fatigue, lack of energy, occasionally low-grade fever, sweating at night, unusual sweating at night, losing weight. And if it's lymphoma happen to be like in the abdomen, for example, you get abdominal pain. If it happens to be in the chest, you get some chest pain and shortness of breath, but it's really nonspecific.
So because a lot of those symptoms are so nonspecific, they could be anything really, at what point would one of our viewers know that they should go to the doctor?
Well, I mean, everybody knows their body the best. When you know something isn't right, when you feel extra fatigue beyond just tiredness from day-to-day work or what you do, you just don't have the energy, having unusual pain, feeling something that you didn't feel before. Any of these things, we encourage people to go to the doctors as soon as possible and not to ignore the symptoms. It may be nothing, but it could be something serious, need to be checked, like lymphoma.
Now, how do you diagnose lymphoma?
I mean, obviously, the history take a good history from the patient, if they have any specific symptoms or not, and then examination is the most important part of the diagnosis. Is the physician or the nurse practitioner or whoever that would be, any healthcare worker, feeling a lump or a mass, and then from there on, then we can do other tests that we need to diagnose it. The most important is feeling an abnormality or diagnosing it by an X-ray and getting a biopsy. And that sometimes requires a very expert pathologist to look at it. The lymphomas are so different types and need sometimes an expert in pathology to diagnose it.
So once lymphoma is diagnosed, what are the next steps?
Well, the next step, we do what you call staging. We need to know, say we felt a lymph node under the arm and a biopsy was done, confirming that indeed it's a lymphoma. The next step is for us to know, how far is it within the body? Is it just limited to this area? Is it gone to other places? Because if you remember the pictures, those lymphatics, like a vascular system, like arteries and veins, they're all connected like a fisherman's net. So often enough, having a lymphoma in one area can easily be found in other places that are nearby or even sometime farther away. So we do what you call a staging, where we require like a CAT scan of the whole body. We do a bone marrow study to make sure that inside the bone is not contaminated with the lymphoma. And then we do a test called the PET scan, where we use the labeled sugar that lymphoma cells like to eat to literally bait those lymphoma cells and make them show up, which is a very, very neat way to make sure that the lymphoma we know exactly where it is in the body.
Now, doctor, what does it mean when we talk about the different stages of cancer?
Stages meaning like how advanced or not advanced the cancer could be. And in case of lymphoma, is it limited to one area? That would be like a stage 1. Or is it 2 areas that are close by, but still on the same side of the diaphragm, either above or below the diaphragm, which cuts the body in half? So that will be stage 2. Or if we can find a spot or more in the upper part and one or more in the lower part, that will be stage 3. Stage 4, which is when the lymphoma is found in an organ like the bone marrow, the liver, the lung, that will constitute stage 4. It is essential to us to know what stage the lymphoma is to prescribe the appropriate therapy.
Dr. Alsawah, this is great information. It's time for another break. We'll continue our discussion in a moment.